So good morning, everybody. I'm Dr. Dick Walker, and I'm coming to you from Spokane, Washington this morning for my Saturday morning science and technology presentation on redox signaling for ASEA. If I could get my slides to advance. Technical difficulty, we'll try this again. There we go. So this is me. I've been a physician for, I think, about 38 years. I'm a full-time ASEA representative at this point in my life. I'm going to talk a little bit about that journey and how I got to where I am right now. But, you know, my purpose for doing this presentation and for being involved in ASEA is not just the financial aspects of this, but I've been involved in helping people with their health for a very long time. And I do that because I enjoy it. I really like helping people get their health back. I like helping people prevent sickness to begin with. I have a master's degree in preventive medicine, which is a little bit beyond what most physicians have. And so I have a really broad view of what it takes for people to maintain their health and to regain it when they've lost it. And that's something that I really enjoy doing. I get a lot of gratitude and fulfillment out of that. And when I discovered ASEA, for the first time really in my career, I found a way that I could match up a career with helping people with a very powerful technology that was outside of Western medicine. And so that's really the main reason why I'm sitting in front of you today, talking about the science and technology of ASEA redox. And, you know, I can remember sitting in the ER late at night, maybe in a slow moment, and wondering if there just wasn't something more I could do for people. I've been an ER doc for a long time. I've seen a lot of sick people. And I noticed that I kept seeing the same people over and over again, sometimes for the same problem or oftentimes for other problems. And I realized that they weren't really doing what they could to stay out of the ER. They weren't really engaging in a lot of healthy lifestyle choices. And so I started reaching out and teaching people about that. But even after all of that, there just seemed to be something missing. There seemed to be, I always thought there was something more we could do to help people. And I started to notice that amongst my friends. And as I got older, I started to notice the changes that were going on in my health that were related to age, even though I've been a fanatic about diet and exercise and all of the lifestyle things that one can do to maintain their health. And I just kept thinking that there had to be more that one could do other than antioxidants and, you know, avoiding too much cholesterol and all those sorts of things. So I was really primed for this technology when it finally came along, because literally I'd been waiting for it for a very long time and just hoping that something more would come along. So I want you to open your mind to something that can work, because your mind works much better when it's open. Are you skeptical? Sure, we all were. I was skeptical in the beginning, not skeptical about something that was an alternative way to improve our health, but skeptical that this company really had what they claimed they had. And after I did my due diligence, I became very excited about what you're going to hear about this morning. So it's okay to be skeptical. We all start that way. It's a self-defense mechanism. But just don't let it keep you from seeing something here that's very real and could really help you and those around you. So open your mind a little bit this morning, because we may be talking about things that are somewhat new to you. And that's where I was a little over 70 years ago. I was working 60, 70 hours a week in the emergency room. I was 64 years old. Why was I working so much? Because we had had some financial downturns in another area of our life. And I just had to work that hard to sort of catch up financially before I could even think of retiring. So I didn't have any spare time, but I knew I couldn't keep up that schedule. And when I first saw this technology, I realized that it just might be the answer that I've been looking for in terms of a health and wellness technology, but it just might be the answer to our financial problems as well. So open your mind to some new possibilities. We're going to primarily discuss the possibilities around this technology this morning. I do have another presentation that talks about the possibilities with regards to the business model. So let's talk about what you might be able to do to improve your future health, because it's really up to you. And hopefully I'll be able to present a vision that you can use to create your new vision for your improved health and those around you. So what we're talking about is the new science of healing. And for you to really appreciate what I'm going to say this morning about redox signaling and about the ASEA technology, you really have to wrap your head around the incredible power that our body has to heal itself, because it's much more effective and much more efficient than we've ever thought possible. And even as a health professional in the business of helping people to regain their health, I really underappreciated what our body could do until I more or less stumbled on this technology. So regardless of what happens to your body, or regardless of what you do to your body inadvertently or accidentally, your body has a remarkable ability to manage those problems and to fix and repair your body at the cellular level, even in the face of what appear to be insurmountable odds. And science is now showing us how to do this in a much better way, a much more efficient way. So I want to ask you a couple of questions, because hopefully by the end of this short presentation, you'll have at least a pretty big part of the answer to these questions. And that is, why do some people recover from the same illness and others don't? What explains miraculous cures, spontaneous cures? Because if we can understand that and we can duplicate that, we can help a lot of people to have similar experiences. And why do some people handle physical and emotional stress, as far as that goes, better than others? And why do some people recover more quickly from injury or surgery? You know, I had to have a total knee replacement a couple of years ago. My knee had held up pretty well for several years after I started ASEA, but I just simply had no cartilage left and I couldn't ski any longer, and I really enjoy skiing. So I went in and had my knee replaced, and I was told that I wouldn't be able to ski or do anything of that nature for 6 to 12 months. Well, I was back on the downhill ski hill 3 months, 90 days to the day after that surgery, about half the time that my surgeon thought I would require for full recovery. And yet my knee was fully recovered and I had a great time skiing that season. And why do some people live longer or live healthier as they age than others do? Because if we can find an answer to this, or at least a big part of an answer, well, we've gotten a hold of something pretty darn important here. And I can tell you the answer isn't in more pills. You know, we have people going to the doctor's office coming away with prescriptions. They don't even know what it's for or what it's going to do. And you know, the statistics show that half the time people don't even fill those prescriptions. And many times, even if they do, they don't take them as directed. So the answer is not in more pharmaceutical products. In fact, the only entity that does well with pharmaceutical products is the pharmaceutical companies. Not that all drugs are bad. Certain pharmaceuticals are absolutely necessary at certain times in our lives, and they can really help us recover from some major problems. But we are the most medicated society in the world, and we're taking too many drugs, oftentimes for the wrong reasons, because we should be looking at something that really addresses the root causes of problems, not just covering up symptoms to make us feel better. And a lot of times in Western medicine, we're spending way too much time above the ground and not enough time working on causes. And we're going to talk to you about this technology today that can actually help you to address the root causes of some of the issues that people are suffering from. So let's look at some of the answers to this, or at least a big part of that answer, because science is really discovering ways to maximize our body's ability at the cellular level to regain our health. not just from specific diseases, but from any kind of challenge at that cellular level, and also to prevent those challenges from developing to beginning. And as we do that, we're also discovering ways to slow down and counter the aging process. We can't turn back the calendar. We can't make your birthday come on a different date, but we can certainly affect the physiologic changes that go on in your body over time. And by enhancing and revitalizing these natural processes, we can really enhance our cellular protection and renewal and our recovery from just about any insult that our body can suffer. So your cells can do a much better job than you probably think they can at fixing and repairing damage, whether it's from wear and tear, just or trauma or infection or disease or aging. So we're going to talk about how do your cells cope with these challenges. Well, they cope to begin with by preventing them in the first place, and that's largely through the activity of antioxidants. And the supplement we're going to talk about today has a tremendously beneficial effect on antioxidant protection. And we're also going to talk a little bit about detecting cells that are needing repair, organizing that repair process, and then last but not least, eliminating those cells that can't be fixed. Because when we talk about aging, a lot of that aging, or at least the consequences of it, are because our body isn't getting rid of cells that are only partially effective and replacing them with brand new ones. And that's a process that exists. We just have to optimize it. So for many years, the pharmaceutical industry has focused on finding blockbuster drugs that address one particular issue, not even one particular disease many times, but one particular part of that disease. And so they've had a rather narrow focus on how to help our health. And yet the company we're going to talk about this morning, ASEA, felt that a much broader approach was indicated, because it doesn't make sense to focus on one thing at a time when our cells have the ability to literally fix everything when they're given the chance. So we're going to talk about something that's redox signaling science that is really opening the door to maximizing that process, because this was a scientific discovery that I'd been waiting for a long time. And it came about 20 years ago, but it didn't percolate into our reality until about 10 years ago. But this science of redox signaling, cellular communication, is really the greatest scientific breakthrough of our lifetime, because it's explaining to us how our body works at that cellular level, how it functions, how it manages those functions, and how it repairs when things aren't going right. So this is really the emerging science of healing through redox biochemistry. And redox signaling molecules literally activate the communication channels inside your cells, and that's the active ingredient in ASEA redox. This is being researched around the world, not at just medical institutions, but it's a very rapidly growing, attracting a lot of money into the research on redox signaling, cellular communication. And you can see that even though we think it's brand new, actually the 21st Congress on redox medicine was held in Paris this past spring. So what are we talking about here? What the heck are redox signaling molecules? Well, they're made in every cell of our body from the moment we're conceived, not when we're delivered, but when we're conceived. And our health is really a hierarchy of things put together that make up you. And that starts at that cellular level. Our body's made up of trillions and trillions of cells that make up tissues and organs and systems, and ultimately make up your human body. But underlying all of that is what we're going to talk about this morning, and that is redox signaling molecules, because they underpin the health of all of those trillions of cells that make up your body. And they're made in something called the mitochondria. You know, for a while I wasn't even mentioning mitochondria, but mitochondria are proving to be a very important aspect of prevention and wellness, because they not only produce the energy that our cells function on, and you have to have that ATP energy. If you don't, it's like trying to run an electrical device without a battery or a plug. But they also produce these redox signaling molecules that are so important to cellular function. And they're made as a natural consequence, or just in the natural process of creating that ATP energy. And these molecules are what we call native to the body. And the molecules that are in the ASEA redox products are identical, virtually identical to those that are made in the mitochondria of every one of your cells. So these are a very natural technology. They're even better than organic and natural. They're native to your body. And so you can't be allergic to them. And because they're native to the body, there's virtually no toxicity. For those of you who are science-minded and want to know what are the molecules that actually are labeled as redox signaling molecules, here's a good example of a number of them. And as you can note, the ingredients all are possible from salt water. Water and sodium chloride make up the essential atoms that make up these molecules. And in fact, that's the basic ingredient that ASEA uses in its 3-day proprietary process of creating a balanced, stabilized mixture of redox signaling molecules. I think I'm jumping ahead a little bit though, because here's a diagrammatic illustration of cell signaling. Here you have two cells bumping up against one another like they do all the time. And they're communicating, they're talking, and they're doing it in these small little molecules that are passing across cell membranes and bringing information back and forth with them. So out of that science, the science of cell signaling, and more specifically, the science of redox cell signaling, came this technology that we now call ASEA redox. And this is a patented product, and it addresses problems in the health and wellness area. Also, it's an athletic performance booster, and we'll talk a little bit about that. But it also can do a great deal in the anti-aging area and in the beauty and skincare area as well. Because when we talk about beauty in this sense, beauty is more than skin deep for sure. So these are patented proprietary products that are made of redox signaling molecules. And this was really a true scientific breakthrough because it took well over 20 years, lots and lots of money to get to the point where we are now with this redox technology. And in fact, the team of scientists that led this final development was a medical atomic physicist. You know, those guys are pretty smart. Gary Samuelson was the one who did the final work on that. I've become a friend of his, and he's a brilliant guy. But a lot of people in the scientific community thought that it was going to be impossible, but we were able to do it. And what we did was to create and stabilize, and that was really the most difficult step, created and stabilized redox signaling molecules in the identical form that our cells make, but outside the body so that we can ship them to your house and you can replenish with those. And here's our landmark product, the ASEA redox. And this was first released on the market in October of 2010. And several years later, the company came out with a topical version called Renew 28. Wonderful product for skin health, not just for skin beauty, but when you get your skin healthy, it looks really good. And that's one of the reasons why we're a big player or becoming a big player in the beauty market as well. This is truly a transformative technology. And because of that, it has huge potential. I mean, it will change everything that we do and how we look at things in a number of different areas of health and wellness. And it'll have an impact even on Western medicine over time as people start to finally understand the power of this technology. This is not something that cures, heals, or treats any particular disease. What it does is enables our body to do a much better job of doing that because it's fully capable in many cases of taking care of problems. And it's also the most powerful anti-aging discovery of our lifetime. If you were looking for the fountain of youth, and quite frankly, there have been a number of false claims to that, this is as close certainly as we've come to the fountain of youth. Because as you age, your mitochondria make fewer and fewer redox signaling molecules. So they decline about 1% per year of life once you hit puberty, which is officially around 15 years old. So by the time you hit the proverbial middle age level, you're already way behind on having enough of these molecules to maintain your health as well as you can. So this is a great way to turn back the physiologic clock on many of those age related problems that people develop. that alone is going to propel this product and this company in the right direction for years to come, and truly will change the world. And just this is my one slide in my science and technology series that takes a peek at the market here. What is the size of this market that ASEA is entering with this unique product? Well, together, the health and wellness, beauty and anti-aging athletic performance product market is, in the US alone, is over $4 trillion. That's a lot of money. That's a lot of customers out there that are looking for what we have, that don't have the slightest idea that we have a bioreplenishment product for redox signaling molecules. And in fact, they've never heard of redox signaling or cell signaling or any of the things we're talking about. So we've got a job to educate people, but we have a product that's the most advanced and newest technology in all of these areas and can help people in incredible ways to get their body to do the job it can already knows how to do, but do it much better. And so sometimes people are still scratching their head and saying, yeah, but Dr. Walker, what are these things? You know, I showed you a list of what some of them were. We've talked about molecules and how they interact. But let's talk a little bit more about what they're not, because I think that will give you a little better idea. You know, we're sold in the supplement market space, but we're not a vitamin or a mineral or an antioxidant. So we're not anything like any conventional nutritional supplement. We don't replace any of those, and we don't do the same job that they do. We do something much different. We facilitate cellular communication. And in fact, we help your body to use all of these other supplements much more effectively and efficiently. But we're not a nutritional supplement per se. There's no food value in ASEA redox. And yet these signaling molecules go way beyond what any nutritional ingredient can do to help your body to restore function, to restore health, and to restore healthy cells and viability. So it's not a nutritional supplement, but it supplements a much different thing, and that's redox signaling molecules. And the depth of the impact that it has can be absolutely remarkable. So is there science behind this? Well, there was a good 20 years of science behind just getting this product to the point where it could be offered to the public. And when I first got involved 7 years ago, there were no books specifically dealing with redox health and redox biology. There are now over 1,000. The first book that was written is that one on the right-hand side. It's kind of a coffee table book on redox life. But there are now over 1,000 books dealing specifically with redox health, redox biochemistry, cell signaling, all of the issues that we're talking about here. We now have partnered, ASEA has partnered with Bioagilytics, which is a large and very reputable laboratory that does molecular analysis. And what they do for ASEA is to run our quality control program. So they certified that every bottle of ASEA and every tube of Renew and any of our other redox products actually contain what we say it does, activated, stable redox signaling molecule. And there is just a ton of science out there. If you go to the National Library of Medicine, which is at the NIH, you can do a search on redox signaling or any associated subject and come up with literally thousands of articles. This one search, just searching for redox signaling, came up with almost 19,000 references. So there is a lot of science that underlies this technology. And why do we need it? Because our cells are constantly wearing out and breaking down. That's an ongoing process that we really need to help our body pay attention to. What does it do? Well, one of the things it does is turns on the genes that are responsible for much of the activity of ASEA. And what is it? It's a cell signaling supplement. But these molecules literally regulate every major body system at the cellular level. They essentially tell your cells what to do and make sure that they do it. For example, they're the molecules that make sure that a kidney cell does what a kidney cell is supposed to do and a liver cell does what it's supposed to do, and they don't get confused about that, what a brain cell is supposed to do. So these molecules are very, very important. And they also open up the genetic signaling pathways that are responsible for many of these functions and responsible, especially for the repair process. This was a study that was done on actually young adult age, 35 years old. And what it showed, the question that we were asking in this study and trying to answer was, would supplementing with 8 ounces of ASEA daily have an effect on signaling pathway genes? Now, these aren't genes that control your hair color or your eye color. These aren't genes that control one particular aspect of your health and your functionality. These are pathway genes, or genes that account for getting the information that's stored in your genes out to the cell where it can be acted on. So these are very important because they make that information available. And what we found was that 8 ounces a day made a significant difference in a number of signaling pathways, but it made a huge difference in 5 of these pathways. In fact, a 20 to 31% positive change. And with any sort of health or medical aspect, when you're able to influence it by that much, that's very significant. But look at, we're talking about immune system, we're talking about inflammation, hormones, we're talking about cardiovascular issues. I mean, this is huge. Huge numbers of people are affected by problems in this area and could potentially benefit by having more information available from their genes. And this is one example of one of those 5 pathway genes. And you can see the number of different aspects, the number of different particular genes that were influenced and information made available. Insulin signaling, NRF2, which is our antioxidant production gene, thyroid, all kinds of different aspects of health, spinal cord injury, that were impacted simply by drinking 8 ounces of ASEA a day. We also have another study that underlies the reason why we're an athletic performance booster, and that is that we showed in this study that it helps our body to burn fat, and it helps our body to lower cholesterol, which is another great kind of side effect. In this study, we're looking to see what effect it had on metabolism primarily. And what we found was that it shifts our body towards a fat burning issue. It makes us a fat burning machine, which for the athlete is huge because we get a lot more energy out of fat than we do out of carbohydrates. So it switches our body to a high octane fuel from a low octane like carbohydrates. And we first demonstrated that in mice when we found that in a double-blind placebo-controlled trial with some exercise type mice, that they were able to go 29% further before they gave up, laid down on their back panting and said, we can't run that thing any longer. And because of what happened in that study and athletes trying this product, we now have top athletes in every major sport that are taking ASEA, not because we pay them to do it, but because it enhances their performance. And the other thing we found was that it really helps their recovery stage because it spares glycogen and gives them some intramuscular fuel to use during the recovery phase without having to take a day or 2 off and carbohydrate load and do that sort of thing. So it is a huge boost to athletic performance. Whether you're a competitive athlete, a weekend athlete, or whether you were my 94-year-old mom who just didn't have the endurance even to take care of herself, you know, getting out of bed, getting dressed, moving around her apartment. What I found with her was that even though she's not an athlete, she got a huge boost in her performance because she could now do all of those things on her own after being on ASEA for about 5 months. So it's a great performance booster. So why do we need it? Well, we're wearing out and our health is being adversely influenced by the environment. It always has been since the dawning of time, but our environment is getting increasingly hostile and having more and more effect on it, especially the toxins in the air and water and the food that we eat, but also the amount of physical and emotional stress that we're exposed to in a rapidly changing world that we live in. And those changes appear on the outside of our body where we can see them, but they also occur on the inside. And so it's important to address both the inside and the outside with an enhanced supply of redox signaling molecules so that our cells can do a better job of dealing with these issues. Because if we don't, we're going to age prematurely and we're going to get sick earlier and we're going to have more illness. And that's exactly what's going on in our society. Why do we need it? Because we want to stay functional. It's not so much that we want to live to be 100 years old, but you know, I'm 71 years old now, and when I'm, you know, 85 or 95, if I'm still around, I want to be able to play with my grandkids. I want to still be able to hold an intelligent conversation and be able to eat my own soup and not have to be fed by somebody else. And so maintaining that functionality and that vibrancy of life is really what this is all about, keeping us as healthy as we can be using our natural resources to do that. So let's go back and ask ourselves these same questions again, because hopefully you're realizing that perhaps this may be part of the answer to that question. This may be a resource that we can use to nudge our body in the direction of doing a better job at recovering from illness, at handling physical and emotional stress, at recovering from injury or surgery if we need to have it, and living a not just longer, but a more functional life. You know, we're starting to see terms like, instead of lifespan, health span. And that's the length of life where you are healthy and able to take care of yourself. And that's really where we want to work on, is maintaining and improving and extending that health span, not just a lifespan. So who creates our health? Well, I guess you do. I know I create mine to the largest extent. Nobody else is responsible for that. Sure, we have to counteract you know, the pollutants that our body is exposed to, but we can do that. And science is showing us how in a much better way. So I would really encourage you to understand and embrace the possibilities of what an enhanced supply of redox signaling molecules can do, both for the inside of your body and for the outside. And the only way you're going to convince yourself that this works for you is to try it. The science is there, it's been proven. There's no doubt that it will help you from the very first sip of ASEA. It will start to help your body fix and repair, because that's what these molecules do. But you're probably not going to fully embrace it until you try it yourself. So it's an experiential type product. And I would urge you to give it at least a 3 to 4 month trial, because when you're helping your body to fix and repair cellular function, it takes a while. It's not usually an overnight result with a product like this. And I would encourage you, whatever age you are, that you can benefit from these molecules, because I know I've helped infants, and my 3-year-old grandson started using this when he was, you know, less than a year old. Uses it periodically because he's got some respiratory challenges, but it's kept him out of the hospital a number of times. And some people say, well, will children drink this? Because it doesn't taste very good. If I have a bottle or a pouch of ASEA in my hand and he sees it, he's over there wanting a sip of it. And if I give him an 8-ounce pouch, he'll suck the whole thing down in about 5 or 10 minutes. So yes, children will take it. It's entirely safe for them. It's non-toxic, and it can benefit children. I've seen adolescents, I've seen young adults. All of my young adult children have had benefits from this product. Some of them don't want to admit it, because my one pharmacist daughter still hasn't wrapped her head around this product because it's not a prescription, but she still has used it for several challenges. And then both my wife and I have had great benefits. I had high blood pressure for years, and I was on 4 different types of blood pressure medicine to keep that under control. And I was at maximum doses of all 4 of those. And if I stopped one of them, my blood pressure went up. And I'm not saying that ASEA cured, healed, or treated my high blood pressure. All I do know that is, without making any other dramatic changes in my life or lifestyle, after 4 years of being on ASEA redox, I was able to get rid of all 4 of those blood pressure medicines and haven't taken them since. And my blood pressure is back to where it was in my 20s. Did ASEA help? I'm sure it did, but I'm not claiming that it cured or treated that problem. I saw it help my 94-year-old mother with her memory. I saw it certainly, as I mentioned, help with her ability to move and to take care of herself. And even her eyesight improved after she'd been on this for a little over a year. So even in people of advanced years, this can help their body to function in a much better way. So I'm going to bring this thing to a close here in a few minutes, but I wanted to show you what redox molecules can do to the outside of your body. We have a great skincare system that has a special cleanser and moisturizer that goes along with our redox signaling molecules. Renew 28 is a great overall skin product, and then the Renew Serum is for problem areas, mostly on your face, but things like scars and other areas you can use it as well. But let's just show some before and after pictures of what results people are achieving with redox signaling molecules on their skin. Now, most of these people are also drinking the molecules, so they're getting them from the inside out and the outside in, but I think you can see a pretty significant decrease in wrinkling and toning and just a much healthier, younger appearance to people's skin here. And all of these results are within 28 days or less of using these molecules. Again, you can see significant decreases in wrinkles, improvements in facial texture. Here you can see some age spots disappearing in a very short period of time. Otherwise, there isn't any other technology that can get rid of those. And then the scar on this young woman's nose is very illustrative of what signaling molecules can do, because she had an injury several years ago that caused her to form that scar as it healed. But then, you know, several years later, she was still making scar tissue in that area as her skin cells turned over. And you have to ask yourself, why was that happening? The injury was long gone, long fixed. And it's because the signaling in that area was sort of stuck on scar formation, as it does when you have an injury. That's what happens naturally, right? Well, look what happened after a month's worth of redox signaling molecules. The scar went away. And the only explanation for that is that the signal in that area changed back to simply making normal skin cells, something it was fully capable of doing for those intervening years, but simply didn't because the signal was stuck. And just by supplying extra molecules and allowing those cells to change their function, they went back to forming skin instead of scar. So that's pretty neat, because we've got areas in our body other than the tip of our nose that could benefit from something like that. Here we have a young man that decided to use redox signaling for this very common condition in young adults. It's an inflammatory, infectious type of skin condition. Again, we don't talk about particular diseases because we're a wellness product, not a drug. And yet, instead of using the potential toxic drugs that get used on this sort of condition when it's that bad, he simply used redox and the condition resolved. So he won't have any further problems with that as long as he continues with the redox, and he'll never have any scarring, which many people would have had if they had not discovered redox for that condition. And here's a lovely sequence that describes in pictures what this can do for the aging process, because when Rosie went to her doctor at age 84, she had a number of age-related complaints, aches and pains and no energy and couldn't sleep, and you know, the usual litany that we often see in people as we get to that age. And yet there is no fix for that in medicine. A lot of doctors would start prescribing things like antidepressants and mild pain medicine and that sort of thing to help control symptoms. Now you start down that path of side effects and all kinds of problems. But her physician instead simply put her on redox signaling molecules, both internally and externally. And it's pretty obvious that even in 7 weeks, her skin was starting to look better. And certainly over the years, not only did her symptoms resolve, but she also looks and obviously feels much younger than she did when she first showed up at his office at age 84. So I'll let these pictures tell the story here, because they're pretty darn dramatic, but they're not at all unusual. And if you start introducing this to the elderly, you're going to get some great responses. But we don't just have pretty pictures. We've got actual clinical results done by clinical testing agencies. And we put all of our products to the test with outside reputable clinical testing agencies like Stevens and Dermatest to test our products. And these are the results they got with Renew 28 back when it first came out. The one that I find very significant is the 50% increase in blood flow, because many conditions of the skin will respond to increased blood flow, wounds that aren't healing, etc. So this product can have more than just making you look better. They can have some very long-lasting effects on certain health issues. So I want you to think, not would redox help me, but could redox help you? Because it's really a new mindset. It's really understanding that you can facilitate that natural repair cycle simply by giving your body some more redox signaling molecules. And by doing that, you can optimize not just your cell's ability to heal, but you can optimize their ability to maintain their function and do what they're supposed to do when they're fully functional. And this is foundational to all cell types. It doesn't just work on one type of cell. It doesn't just work on your skin. It works on every kind of cell because it works at that foundational level. So it works on brain cells, it works on muscle cells, it works on bone cells, it works on kidney cells, it works on liver cells, and on and on and on and on. So if you need more information, if I haven't been able to get you past that skeptical phase and into a state where you're willing to try this for yourself and give it that 3 to 4 month trial, then here's some sources you can use. And I would encourage you to take a screenshot. See a Healthy Self is a Facebook site. You have to be added to that by a friend. So first you have to be friended and then on Facebook and then be invited and accept. But there are literally thousands of testimonies there. So we have science and we also have a huge number of personal testimonies. People who have used this product and then submitted their results to this site. There's another site for experiences, and that's redoxexperiences.com. You'll need that password that I have in parentheses there, experiences with an exclamation point. If you want more information on the science that ASEA has done, such as that DNA study, then go to ASEAscience.com. And if you want to search redox signaling, the new area of science that underlies our technology, then go to pubmed.gov. And search redox signaling cellular impacts or any other issue regarding redox signaling. Do not do a standard Google search. In other words, when you get up on your search engine, don't just put this in the search bar, because what you're going to get is a bunch of opinions there. Now, you're welcome to do it, but just understand that those opinions will run the gamut from this is great to this is terrible, but those are only opinions. That's not a factual search engine. But if you like Google and you'd rather use Google instead of the National Institute of Science, then you should go to google.scholar.com and do your searching there, because that will search for factual, proven, documented information, not just somebody's opinion. So those are some places where you can go get more information. You can go to my website, dickwalkermd.com as well if you want to, and search out some information there. But that should give you plenty of options for learning more about ASEA if that's what you want to do. We also have a great line of nutritional products. These are nutritional products. These are micronutrients. We just added a new one. I haven't put a picture in yet of an omega-3. What I've been reading about omega-3 tells me that everybody should be on an omega-3 supplement, especially as we pass the 50-year age range kind of thing, because it's very beneficial for our hearts and our brains and our cognition and memory. But it's also very beneficial for young children and infants. And it's important for pregnant moms to supplement with omega-3s, not only for the health of their developing baby, but for their health as well. So micronutrients are a vital part of cellular health. And when you combine redox signaling and the ASEA via micronutrient products, what you get is cellular wellness. You get total cellular wellness. We're the only ones with a complete solution we have redox signaling molecules and nobody else does, because we have a monopoly on this technology. And quite frankly, we have the best micronutrient products in the market as well. And they've been designed to work synergistically with the redox molecules. And that's why it's so important to use these products as well. ASEA provides the labor. VIA provides the building materials for repairing and making new cells. So the best way for you to predict the future is to create it. I've given you some opportunities here that I think you can use to create your better health. Also, the ability to help others by reaching out and introducing them to redox. And when you do that, you're going to make a huge difference in somebody's life. And right there, those three aspects, that's our business model. Help yourself, reach out and help others, make a difference. And I guess I should add, make some income. Because if you help somebody else, if you introduce somebody else and they decide to use these products to benefit their health, then ASEA is going to say thank you to you in the form of a check. So what does success look like? Only you can decide. What does health and wellness feel like? What do I want for my own health? Because no one else can do that for you. You've got to create that vision. You've got to take advantage of this information if you want to improve your health to the levels that I know this product can do for you. How do you get started? Well, you can become a retail customer. Most people don't like retail, but you're certainly welcome to do that. Or you can become what we call a preferred customer and get the wholesale benefits as long as you agree to try this for at least 4 months on an autoship program so that you can really determine what this can do for your health over a period of time. Or you can become an associate. The only difference there, well, not the only difference, but it does cost you a little bit more. It's a $40 fee. That's for setting up your website and getting you all the materials so that you can start a business. You also then have access to what we call a one-time enrollment order, where special groupings of products at a further discount. So that's available to you as an associate, but not as a preferred customer. And then you really want to take advantage of our autoship program, because when you do that, you get what are called loyalty rewards points, which can, when you're a mature customer, meaning that you've been with us for 120 days, I think it is, or 180 days, you're at a 20% LRP reward, which means that for every dollar you spend, you get $20 to use on free product as a reward. So when you spend $100 on an ASEA product, you get 20 points that you can trade in dollar for dollar on more product. You also get free products through that program, and you get discounted shipping. So most people that think that they're going to share this with anybody or want to get more than 1 or 2 small products, most people do enroll as associate to get these benefits. So get back to the person who invited you, and they can take care of you on that. And I'm going to stop the share at this point, and I'll take a couple of questions, and then I'll be back at 10:15 for training. So let me close this. Okay, anybody, if you have a question, just click on your microphone icon to open it up, and I can try to answer any questions you might have. Oh, there's the Akies. How are you doing this morning?
Hey, we're doing great. We're doing great. Thanks, down here in Georgia. I have quite a few kids with congenital abnormalities in their chromosomes. Trisomy 21, trisomy 18, a lot of issues. Are the molecules, do they actually help prevent some of the issues? Probably the studies aren't done yet. For instance, Down syndrome, they have more likelihood of getting leukemia or thyroid problems or diabetes later on. Are the signaling molecules help prevent those other problems, or we probably don't know yet?
We don't know yet. I would suspect that they might have an influence on that. But I don't even know if we understand the genetics of why they have those kind of downstream, problems. But all I can say is that an ASEA supplement for somebody with that sort of a problem, what it will do is maximize their chances of staying as healthy as they can, but it's not going to correct the genetic abnormality. Yeah, but I've seen some infants with some, unusual, these syndromes that are named after whoever it was that first described them. And, there's just not very many of them. I've seen a couple of kids have significant improvement in their functionality when we give them redox. They certainly aren't normal, but they become much more functional. So I think it's worth a trial in any of those kids. And, you're only going to know long-term if it helps some of those other problems, because we just don't have those answers. And the product hasn't been out long enough for us to even probably have much of an insight into that.
How did you phrase that? Maximize?
It maximizes their chances of their health being as good as being as healthy as they can. And that potentially, I think, could decrease some of these other consequences that they're having, because I don't know that those are directly attributable to the genetic abnormality.
Thank you.
Thank you.
Any other questions?
Yes, this is Elizabeth, and I have been taking glutathione IV over the years as recommended by my medical doctor and my naturopathic doctor. And I've come to realize that taking the redox.
Yeah, you're breaking up, but I think what you're asking is, do you still need to do the IV glutathione? And I would say probably not, because what we found with the ASEA is that it increases your cells' native production of glutathione inside the cell where it needs to be, and that IV glutathione, only some of that gets into your cells because it's not the easiest thing to get from your blood into the cells. So I think you're far better off with the ASEA, and you're probably not getting much additional benefit, if at all, from getting the IV glutathione.
I would agree, because I'm so sensitive and reactive that even though these IV treatments cost a couple of $100s every time, I never felt a bit different after them. So, and I certainly
think a lot of that is probably because, in increasing our antioxidants is probably not going to make us feel better, but it's definitely helping because it's mostly a prevention thing. And also, it could also be that I've not really looked really hard, but I haven't been made aware of any studies that show how much of that IV glutathione actually gets into your cells. Because having a lot of glutathione floating around in your plasma, that's not where you need it. You need it in the cell. And so it may be one of those kind of gimmicky things that we think might work, but does it really help, But what ASEA does is actually increases the glutathione in the cell, which is where it does its job.
Thank you. I saw a graphic on one of the Facebook groups, and it says that the ASEA redox liquid can increase the glutathione production in the body by more than 500%.
Right. Yeah. And that was full disclosure, that was an in vitro test, not an in vivo. So that was in a cell culture. And what they did was provide a concentration of ASEA redox that was as though you were drinking 8 ounces a day. So it didn't hyper supplement with the redox. And what they found was 500 to 800% increase in glutathione and superoxide dismutase, both of the major intracellular antioxidants. And that would certainly imply that you would get that if you drank it as well. But the other interesting thing is that there are some other companies out there that are marketing supplements that claim to increase the intracellular glutathione. All of their research is in vitro as well, because it's very hard to do those kinds of studies in a living person. It's much easier to do it in a controlled situation in the lab, but that information certainly seems to be apropos to our, real people. So I think you're on the right track. I would stop the IV and buy more ASEA.
Right, I did. And coincidentally, my doctor of osteopathy, who is a very smart person when it came to nutrition and how to address conditions through nutrition, he had me taking SOD, the superoxide dismutase. And so I'm thrilled to hear that that's increased from this as well. Thank you.
Yeah, I've never been convinced that taking oral superoxide dismutase really did much good. Yeah. Now that we have something better, for sure.
Great. Thank you very much.
Okay, great. Any other questions? Otherwise, I'm going to go get a fresh cup of tea and come back at 10:15 for a training. Awesome. Okay, great. Thanks, everybody. Stop this.
Thank you.
You bet. See you later.
You bet. Okay, so we're going to get our leave meeting down here.